My research program focuses on the impacts of stress, particularly during puberty and adolescence, and how that impacts the onset of mental disorders like depression and anxiety, but also how that may then kickstart the process of neurodegeneration that can manifest itself later on in life. I also put a lot of emphasis in my research program to advance women's health research and to bring more information to health issues that are specific to women. With Lallemand, we've been collaborating actually since 2019, so we have quite a long-lasting relationship, which we are very grateful for. Lallemand has provided us funding for our research, has provided probiotics that we have been incorporating in our research on the gut-brain axis, but also provided scholarships through the MITAX federal agency that supports at least 2 of my graduate students each year. So I'm extremely grateful for this collaboration. So we have 2 projects that are currently ongoing with Lallemand. One is focusing on the impacts of chronic stress, chronic unpredictable stress, which mimics what humans are exposed to, but we're doing this in a mouse model, and how chronic unpredictable stress, particularly during puberty and adolescence, may activate the neuroinflammatory pathway, which is involved in neurodegeneration, and how probiotics can come and mitigate the impacts of chronic stress on the neuroinflammatory pathway. Our other research project has to do with Parkinson's behavior in particular. And we are using a mouse model again to look at how inflammation during puberty and adolescence can cause then neuroinflammation in the brain that impacts the remodeling and the reorganizing of the brain that takes place during that period, which may then cause motor deficits and kickstart the onset of Parkinson-like behavior. Our work shows that because the pubertal and adolescent period are periods where the brain is being remodeled and reorganized, when neuroinflammation or stressors come on board, certain stressors, not all stressors, come on board, they do impact that remodeling and reorganizing in the brain. So some of the effects are quite long-lasting, even permanent on the brain's functioning. And so this is why we want to see if there is any possibility that we could prevent the onset of neurodegeneration that manifests itself much later in life, but if there's any way that we could prevent the mechanisms that start the process early in development. We know that there is a lot of communications between the gut and the brain through the gut-brain axis. It's actually a bidirectional communication. And it seems that by altering the gut and colonizing it with good bacteria, anti-inflammatory bacteria like probiotics, we are able to mitigate in many ways the effects of stress, of chronic stress and inflammation on the brain. And so we can protect the brain and mitigate the impacts, the negative impacts of these stressors. This work inspired me a lot because when we look at certain neurodegenerative disorders like Alzheimer's disease, we do see that women are much more likely to develop Alzheimer's disease than men. And that is even after we correct for longevity, because we know that women tend to live longer. And so it's other factors that are contributing to that. And this is why in our preclinical models, we always include males and females because we want to understand what increases the vulnerability of females to neurodegeneration and certain mental disorders as well. Is it hormonal? Is it stress? Is it other factors that are in the environment that could then impact and predispose women to these conditions? So my work is always to bring new knowledge. I want to try to bring new knowledge, and I want to work on the prevention side of things. So I want to try to see what we can do to prevent the onset of neurodegeneration, to prevent the onset of mental disorders in our adolescents, in our women, in our older adults. So I'm trying to work on all these facets with my team. So as you know, our research is preclinical and we've been working with mouse models, but the idea is always to then try to take those findings that are from fundamental research to then apply it to the clinic and clinical research. We work with concrete problems that we find in clinics, and we want to keep our research current. So it's a really bi-directional process where we want to learn about the issues that are present in hospitals and clinics and in humans and bring that to the laboratory to try to understand what's the mechanisms that are underlying these issues and how we can maybe try to treat them or prevent them, and then bring that knowledge back to the clinic.